positive mood effects of exercise involvement, independent of fitness gains, suggests that the focus should be on frequency of exercise rather than establishing duration or intensity until a behavior of regular exercise is well established. I think that's the most important thing that we can do to help our patients. Because I was trying to find some studies and figure out, well, I need to prescribe 150 minutes of exercise to my patients, blah, 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 blah. And why I don't think that's important is there's so many different studies looking at this, and that's why I think it's so important to look at meta-analysis, because what it talked about a lot in these meta-analysis papers dealing with exercise and mental health, in each single one of these interventions, each one of these studies, there was different amounts of exercise, different amounts of intensities to each one of these interventions, okay? So lastly, what I want to kind of touch on is, let's at least get in a little bit of the nitty-gritty of exercise versus antidepressant treatment, because we've been talking a lot about depression. So there was a meta-analysis that I was looking at. I can provide the link if you guys want to peruse it on your own. And it was looking at exercise versus SSRI. So this was... most all of them making generalizations were roughly these people exercising 3 times a week, walking or jogging, and these were group exercise classes, and I think that's important. And what it was showing is in a sense that all of these studies showed that exercise was equally as efficacious as an SSRI after 4 months. I'm not going to comment necessarily on better or worse, but equally efficacious. What do you think about that?
I think that's profound. I think as psychiatrists, right, when a patient comes to us with depression, we inherently have incentive to prescribe an SSRI, right? Mm-hmm. You go to the surgeon, he's gonna want to cut on you. You go to the orthopedist, he's gonna say you have a broken bone, right? This is the lens that we see the world through. This is what we do on a day-to-day basis. So I think there's many times where our first thought process is this person needs to be on an SSRI, and that's our inherent financial incentive as well. But at the same time, like, exercise is just as good as an SSRI, right? So in that sense, like, I wish if I could control things in the world, which I obviously can't, I would prefer all my patients to just exercise, because exercise is so much more than just a relief from your anxiety or depression. So for example, like when you're exercising every day, that's also a mental workout that you're doing. You're getting up every single day. At the same time, you're making that commitment and getting to the gym or doing something. It doesn't even have to be to the gym, like Dr. Noone talked about. You can just go on a walk for 5 minutes every day. But when you have that sense of accomplishment every day, when you know that you can fight through that voice in your head that says, no, we're not going to exercise today. It's too cold outside. You're too tired. But when we have the benefit, when we have the training of being able to tell that voice, no, I'm going to do it anyway, that carries over to other aspects of your life. And you can carry that over to your career, to learning a new language, developing a new skill, whatever it is. But it translates to so many other aspects of your life that can lead to more positivity. So if I can control things in a perfect utopian world, I will prefer all my patients just have this habit of exercising every day. But at the same time, we have to recognize that, in reality, this is the same conversation that internists have with their patients about diabetes, right? Mm-hmm. Lifestyle modifications, go exercise more, change your diet. But for many people, it's an almost impossible task, it seems like. And I think to a certain degree, there's people that that come see you and they are looking for an SSRI. They don't want to hear you say like, hey, you need to just go exercise every day. Right. Because one is significantly harder than just popping a pill in the morning. So I think there's that element that we have to consider as well.
Right. So a couple last things I want to share before we conclude this episode. So there was another meta-analysis looking at exercise combined with antidepressants versus antidepressants alone. And I thought what was very interesting is there was a third arm of the study that compared it against placebo alone too. Because remember, placebo, people actually do feel like they get better taking a placebo for depression, which I always think is hysterical. And it's like unethical for us, or supposedly unethical for us to prescribe a placebo. I would argue it's not and I actually do want to prescribe placebo one day and see if a patient gets better. Because I feel like sometimes people are so fixated on medicine. It's like, okay, well, I'll give you this sugar Zac. It's just a sugar pill that's Prozac. Maybe they'd get better, and then they wouldn't have to deal with any of the side effects associated with Prozac. But so it looked at this study for depression, comparing exercise combined with antidepressants. It actually, funny enough, didn't compare exercise with placebo. And actually, I misspoke. It did. So it was exercise with antidepressants, exercise... No, it didn't. Exercise with antidepressants versus placebo. Okay? And it was this meta-analysis across 11 randomized controlled trials. And I feel like I always throw out this meta-analysis term. But in my opinion, this is really the gold standard of medical research because it removes a lot of the bias. With one small study, you can certainly try to influence to get an outcome you want, versus meta-analysis is collecting data from a bunch of different studies and trying to get a real conclusion across a big sample size. This was 11 studies. And all the studies but one, so 10 of the 11 studies, showed that patients who used exercise as an adjunctive treatment for depression showed a significant improvement in depression improvement after the exercise period, or that of the proportion of a clinical response larger than the exercise group or the control. Which I feel like is kind of, I think, where we should advocate the most. Like, it seems like the best treatment, especially for really profound depression, is a combination of both, like SSRI or maybe other acceptable antidepressant treatment with exercise.
Right. So, in essence, I guess the takeaway is whether you're on an SSRI or you're not on any kind of medication for depression, exercise is going to help you. It'll make you feel better.
Certainly. Last thoughts is, part of this study was actually looking at following these patients for quite some time. And it set people up in between, they had to do 3 to 5 sessions a week and report moderate intensity cardiovascular workout for 4 to 16 weeks during this time period. And it was looking at group exercise with supervision versus individual exercise habits. What do you think I'm about to say here?
I have no idea. Go for it, Logan.
Well, I think I wasn't surprised at all that people who do group exercise programs are actually more adherent to doing those treatments or exercise sessions. And maybe they start to develop friends at that group class. Maybe like us, we play basketball on a regular occasion. I think it makes total sense. Like, I exercise alone, but I do get more enjoyment when there's someone else there. There are times where I actually prefer to be alone, but I actually wonder, if part of our outpatient treatment when that patient leaves the hospital, we set them up with an outpatient psychiatrist, an outpatient therapist, but what if we actually had to set them up with some kind of outpatient group exercise program and they could pick, hey, you're leaving the hospital. I know you've been through some shit this last 5 to 10 days that you've been here. Well, you get 2 months for free at this yoga studio. You get 2 months for free at this gym, but I want you to go to group classes, whether it's, a Zumba class or a whatever. I think trying to build these communities around exercise, in my eyes, is the most effective means to actually accomplish this goal.
I wonder how many patients would actually follow through with that.
Do you think they would
I'm just pessimistic.
I'm pessimistic too. I mean, how many of the medicine do we prescribe that our patients never take when they walk out the door?
Right.
But I would wonder, maybe we should do this study if we could ever get that thing. Would people be more engaged to go to a Zumba class than to take my antipsychotic every night?
That would be an interesting study to look at.
Right.
But the group exercise totally makes sense because, one, you have an accountability buddy essentially, right? And also, I think a factor that can't be understated is the fact that when you're participating in group exercise, you're also getting human interaction.
Right.
I think one of the biggest issues with depression is that it leaves you prone to self-isolation.
Right.
And we know it's pretty well documented that even small pretty superficial human interactions, such as going to the grocery store and just saying hello or asking somebody like, how much is this? Even an interaction such as that can help you feel better. So it doesn't come as a surprise to me, Logan.
Well, if you have listened to 38 minutes of us babbling, just get some exercise.
It's good
Hopefully
for you.
we convinced you. And we're not even talking, well, I don't even want to get into intensity, duration. I want to focus on frequency. Try to get in the habit of doing something most days of the week.
Right, and it does, like you said, Logan, it doesn't have to be anything intense, even a couple of minutes. If you're somebody that's not used to exercising, hey, start off with a minute a day. That's okay.
Right.
You want to start building that positive momentum. And you
Anything's
want to
better
get
than
that,
zero.
exactly, that sense of accomplishment every single day. And all we can do is start where we are and continue to build better towards a brighter future.